Kaylee is my technical expert, giving me direction on the controls, which I am figuring out step by step. So again, this is the link for where the recording for today's webinar will be available once we have that stored in the cloud. And again, my name is Susan Lee, Information and Guidance Coordinator for Sedgwick County Health Department. Today we have our presenters with us. Annette Graham, Executive Director. She's with Central Plains Area Agency on Aging and Sedgwick County Health Department, or Sedgwick County Department on Aging. And then we have Kaylee Hervey. She's our Epidemiology Program Manager with Sedgwick County Health Department. And we have Cody Shervett. He is a KCEM Operations Officer from Sedgwick County Emergency Management. And our agenda for today includes a COVID update, information on the NP and saliva testing, updates from CMS and KDADS on testing and reporting requirements, information about the COVID vaccine here in Sedgwick County, and then we will have information updated on the PPE stopgap program and the N95 Decontamination Services. We'll have an intro on the emergency public health order for Sedgwick County and some information updates on phase 2 metrics for Sedgwick County. And then we'll go into updates on the compassionate care, indoor, outdoor window visitations, requirements for CMS and KDADS, followed with a Q&A with our presenters, and we have lots of resources for you. And following, like I just said, everybody will be able to submit questions in the chat box and comments following our presentation. And our next meeting is scheduled for March 26th. The time is later in the day from 2 to 3. And the forum is here to help provide updates, maintain ongoing contact, and to be responsive to the needs of all of our nursing homes and adult care homes here in Sedgwick counties. And we are always looking for your ideas and best practice topics that you may submit to me for inclusion in our monthly meetings. And at this time, I would like to turn over our controls to Kaylee Hervey. She will take information on the COVID-19 update. Thank you, Kaylee.
So as of now, we're experiencing 28,261,979,000 cases in the United States. We've got 291,715 cases in Kansas, 44,399 cases in Sedgwick County, 506 deaths in Sedgwick County, and we currently have had 86 total adult care home clusters, and we have 808 active cases in those clusters. So when we're looking at testing for adult care homes, so staff can still be tested through the Sedgwick County Health Department at our site at the K-State Research and Extension Center. That is at 7000 West 21st Street North. They did shorten the hours, so we are only testing now from 8:30 a.m. to noon, Monday through Friday. But it is walk-in, no appointment needed, and first come, first serve for that. Currently, our test results are taking 2 to 3 business days. And then right now, if, as always, a staff or a resident at your facility does test positive, we are recommending that other staff and residents in your facility be tested per our recommendations or KDHE's recommendations. So again, any residents with or without symptoms can also be tested through that location. It's not just nursing home staff. It can really be anyone, whether or not they have symptoms. And we have our procedure for long-term care testing for employees, and you can view it at the link below. For the CMS and KDADS COVID-19 testing requirements, right now, routine testing intervals must continue for staff who have received the COVID-19 vaccination. That recommendation has not changed at this time. Even if you've received both doses, they are still recommending that you do testing at routine intervals. They are requiring, CMS does require skilled nursing facilities to test their staff and residents, and there is that executive order from the governor that also requires that testing. And we also have the CMS final rule on nursing facility testing that you can view at this website as well, and this interim rule as well. And then the CDC still has their guidance for SARS-CoV-2 testing, point-of-care testing. They did update that on February 5th, and so there are regulatory requirements for point-of-care testing and who can do that point-of-care testing. And if you're doing that point-of-care testing, remember you must be CLIA certified. And so Governor Kelly's executive order does require KDADS licensed facilities to perform testing of all staff and residents with symptoms, testing of staff and residents in response to an outbreak, and then routine testing of staff based on the county positivity rate. And KDADS did issue guidance in October requiring nursing homes to use the 2-week positivity rate from KDHE. And you can go find that by going to the website on this link below, or if you just go to KDHE's page, it is under COVID-19 in Kansas, and looking for the data, you'll look for nursing home metrics. Currently, Sedgwick County is sitting at, we're doing pretty good compared to what we were in the past month or so. We're at 5.3%, so we've dropped into the orangish color. And our rolling, that looks at the rolling 14-day period, so it looks at 2.7 to 2.20. And then if you want more information about KDHE's unified testing strategy or their report, you can view those at the links provided. And then just a reminder that KDHE does have a reporting portal for anyone doing testing. So this mentions the mandated facilities for the BINACs now, but if you are doing any kind of testing, then you are required to report both positive and negative test results to KDHE's portal. And if you are CMS funded and the test is positive through the antigen testing from that BINACs now, or that BINACs rapid test, then you must have the NP test done on that person within 48 hours. So we've gotten a couple questions. I'm going to go ahead and address those now before we move on. So we have a question. All of our residents have been COVID vaccinated and received their shot 3 weeks ago. The residents are asking if they have to quarantine upon return if they leave the facility for appointments. I will have to double check, and I'll do that while Cody's speaking. I'll look up the guidance, because I know for general population, they do not have to quarantine, but I think there may be something specific for long-term care residents, so I will double check that and answer that question here in a minute. Annette, do you have that answer pulled up?
I don't believe KDADS that there was ever a requirement for facilities to quarantine once the person left the facility. Is this a nursing facility asking the question?
It is. I'm not sure. Oh, yes, they say yes.
Okay, I'm not aware that KDADS ever required a quarantine once they left, but if you're a licensed facility under KDADS, you might want to ask that question, but I'm not aware that they ever required quarantine once they left the facility. Okay.
They said they were told
County
to check with
decision.
county. Yeah.
Okay.
Yeah, I will double check what we have. I'll pull up the document. I don't know it off the top of my head, so I don't want to tell you wrong. So I'll double check that. And then we also have a question, what do you recommend for how to acquire COVID vaccinations for new residents admitted to the nursing home? All of our other residents have been vaccinated already.
You want me to respond?
Yeah, if you've got the answer.
Yes, for any facility already having residents vaccinated, completing their first and second doses, Sedgwick County Health Department is surveying facilities, including nursing homes, adult care homes, and getting that information is going to help us with future vaccination. Any facility needing that information, we have sent emails. I can resend the email to all the facilities since most of them, I'm sure, have already gone through at least the first, vaccine and probably already second by the end of this month, from what we're hearing. So we will get that email out to the facilities, all the nursing facilities, adult care homes, and it just lets you put in information for your resident turnaround and then your numbers going forward so that we can do a better and more precise vaccine planning. So we'll get that information via email out to everybody following today's session. All right? Thank you for that question.
Yeah. And so I was able to find that while Susan was speaking. So right now, KDHE's recommendations for somebody who has had both doses of the COVID-19 vaccine is that if they are fully vaccinated, so more than 2 weeks following the receipt of the second dose of their 2-dose series, are within 3 months following the receipt of that last dose, and are asymptomatic, then they, if exposed to someone, do not have to quarantine. So they have to meet those 3 criteria to not have to quarantine. There is an exception for vaccinated inpatients and residents in healthcare settings. So depending on your type of facility, you may fall under that exception. If you are an inpatient or resident in a healthcare setting, they must continue to quarantine following an exposure, regardless of having both doses.
We can follow up with that information too.
Yeah, we can provide that information. KDHE has a guidance document, so we'll make sure we get you the actual wording for that.
So Kaylee, just to clarify, that's only the requirement for quarantine in those instances would only be if they have been known exposure.
Correct.
Okay.
Correct. That is if you are a known exposure to a confirmed case. That would be where that would apply.
Thank you.
KDHE themselves do not address people who just go out of the facility and come back. That would be a question again, still probably for KDADS. But
well,
if they are known exposure.
Well, it sounds like KDADS is leaving that up to the county because KDADS didn't have a requirement regarding quarantining once the person left out. So if the county is, you know, in line with what KDHE says, if the county then says, yes, they don't know there is no need to quarantine just for leaving the facility. And sometimes that's just to a doctor's appointment or for a family visit or so it sounds like that's up to the health department and Dr. Mintz to make that, that they could say no need for quarantine unless they meet that criteria of KDHE.
Yeah, and we are following at this time KDHE's guidance. So I would say if your facility, you can always be slightly more on that. If you feel like there's an exposure, you can look into that. But our requirements right now are going to be in line with what KDHE is saying. But yeah, if there is a known exposure though, then that would be, you would want to consider the quarantine. Okay. So looking again at the reporting requirements for nursing homes. Remember, all testing and results must be reported to KDHE. If you are sending out your specimens to a commercial lab, typically those labs will do that reporting. But again, if you're doing point of care testing, then you need to report that on KDHE's portal. KDHE will then report those to CMS on behalf of your facility, and we will also be able to access those results. So you must be doing that reporting to meet CMS's requirements as well as KDHE's requirements. If you have questions about how to report, you can email KDHE at their EPI hotline email, and that's provided. So moving into the vaccine information. So again, we've passed our deadline for enrolling in the pharmacy partnership. Your facility should have, hopefully by this point, received your vaccinations through either CVS or Walgreens. If you have questions about that, you can reach out directly to CDC. If you're not enrolled, then you can reach out via that survey that Susan was referencing, and she'll resend out. Or if your staff do qualify as healthcare associated workers that do qualify, may make an appointment at our clinic if they have not already done so. And then if you are wanting to serve as a vaccine provider, then you may review that information at KDHE's website, and that's been provided. Or if you have questions about becoming a vaccine provider, you can reach out to KDHE directly. And more information about the provider enrollment can be found at the link that we've provided, as well as more information about the KDHE's vaccination plan. And then there are some additional vaccination resources available as well, so you can click on those links if you're interested in those.
We have another question.
So we have another question. What about staff who get exposed or turn positive and have been fully vaccinated? Per CDC, should there be no quarantine? If the staff is just exposed and it's been greater than 2 weeks since their second dose, and they are within 3 months of their second dose, and they don't have symptoms and they're exposed, then they would not be required to quarantine. Anyone, though, if they test positive, anyone who tests positive must be in isolation, and the exemption is only for people who are close contacts and are in quarantine, not people who test positive. If they test positive, they must be in isolation and should not be in your facility. Or if they're a resident of your facility, should be isolated away from other residents. And that's, if they test positive, the vaccine does not impact the PCR or the antigen test. So if they have a positive antigen or a positive PCR test, then that means they are positive. The vaccine does not affect the results of those. So are there any other questions about testing or vaccines before I turn it over to Cody? All right, Cody, I think you're ready to go.
All right, thank you, Kaylee. Good morning, everyone. Thanks for joining us today. A lot of what I'm going to talk to you about PPE and the N95s has not changed much over the last few weeks. There is, however, one important update at the very end of my presentation that we'll get to in due course. Now, of course, through the EOC here locally, we can only provide PPE directly to first responder and other government agencies. For the rest of you that are in nursing facilities, assisted living, all the facilities that you see on the slide right now, you can order PPE through the state through what's called their stopgap program. Now, I need to correct what I just said there. You still submit the request through us in emergency management locally, but we do go through KDHE, KDM to get that. KDM is the state ordering facility. So in order to get that through the stopgap program, you do need to try and order the supplies yourself through your normal vendor process. And then if you're back ordered or denied for whatever reason, if you can provide that proof of denial documentation, we will submit that along with your order to KDM, Kansas Division of Emergency Management, and we will get that PPE ordered from you. The types of things that you're able to order, well, the main things that everybody is looking to order are the mask and face shields, the gowns and coveralls, and gloves and other PPE requirements, disinfecting wipes, and those types of things are all available. The link to that is part of the presentation, the slide presentation, and you'll see that when those slides are sent out later on. Now that's how it works normally, and as you see on the slide now, there is an important exception to that. If you have an immediate need, if there has been an outbreak, for example, at your facility, and you have an urgent, immediate need for this PPE for life protection, life safety measures, then we don't need to go through the proof of denial process. You will need to contact our folks at logistics@sedgwick.gov. We no longer have a resource ordering form. A month or two ago, we switched over to an online ordering portal, very similar to what you are used to in terms of filling out a shopping cart and all that type of activity. You just need to get a login account from us. And again, that's requested through logistics@sedgwick.gov. If you're experiencing those urgent circumstances, in your email, explain to us, what the circumstances are. Make sure you give us your contact information, because we will get back with you and get that login information to you so you can get the PPE ordered right away. The other thing that we want to talk about next, as I mentioned earlier, first responders, government agencies, you can still order through us directly here at the EOC. Again, we've got that shopping cart ordering system I was just referring to. there's the link to actually log on if you already have an account. But if you don't have the account, again, you'll contact us at logistics@sedgwick.gov, and we'll get that information to you. And then we've got a couple of contact information points at the bottom of this slide. On the next slide, we're going to talk about the N95 respirator decontamination program through the Battelle process. That is still active. That's funded by FEMA, and the contract that they have in place right now will last through March 31st. If you haven't already, please sign up for that Battelle decontamination service, and you see the login screen there, the login link rather, to get signed up for that. And a reminder that it is at no cost to all facilities. The most recent news on that, as we see on the next slide, is that originally they said that the decontamination process was good for 20 cycles. They have now downgraded that, if you will, to 4 decontamination cycles is all that they recommend. If any masks show up, this has been true from the start, if any masks show up with soiling, some type of contamination, whether it's makeup, blood, other bodily fluids that are on there, they will be rejected, and they will not even attempt to decontaminate those. And so they will send those back to you. So with that in mind, we have been recommending that facilities may want to look at, as we see on the next slide, facilities may want to look at developing a usage policy that is going to help your staff keep those N95s as clean as possible, and therefore eligible for as many decontamination cycles as is prudent at this point. The new information that I alluded to earlier is on this slide now. We just got this from the State Division of Emergency Management within the last 24 hours. They've been contacted by 3M that there are a lot of fraudulent N95 masks out there. And unfortunately, it affects a lot of the most popular models, the 1860, the 1860S, and the 1870 Plus. We've got a handout that came from 3M with more details, and that will be sent to you via email along with the slide deck when this whole presentation is over. I looked at it. It does have a complete list of the model numbers that are affected, or the lot numbers, I should say, the lot numbers of N95s. There are like 40 different lot numbers. So it may take some research on your part to see if you've got any of those fraudulent ones. If you do, the recommendation is that they be thrown out, or contact who you got them from and see if you can get compensation back for those, because the recommendation is that they not be used. They are fraudulent and therefore not as reliable as a regular 3M mask. So that is all I have. We will turn it back over here, but I do see a question in the chat box. Do nursing homes still need to do the burn report weekly? And the answer to that is yes, please. We have to submit that information to the state. The state has to submit it to FEMA. It does help us continue to be on the list for receiving PPE supplies for everybody here in Sedgwick County. So yes, I appreciate the amount of work that goes into that, and thank you all for doing that. We do still need to continue to do that. And unless there are any other questions that pop up, I'll turn it back over to Susan and the health department.
Kaylee will continue with the emergency public health order update.
Thank you, Susan. Thank you, Cody. So the most recent emergency public health order was signed and became effective February 7th, and it is effective through March 20th of 2021. So it was revised to prevent the spread of COVID-19. Residents are still required to wear face masks in public spaces, both inside and outside. It does still include that definition of a face mask that does not include anything that has a one-way valve or a vent through which air can be exhaled. And again, there are exemptions for wearing masks that are specified in the order. This order does allow, it did loosen some restrictions based on our current positivity rate and case numbers. So it did increase the mass gathering size to 100 or fewer individuals. But again, individuals should generally maintain 6 feet of distance from one another, and as stated previously, are required to wear a mask within any public spaces. If you would like to read the complete order or any frequently asked questions, those are available at the link provided. Sedgwick County still remains in phase 2 for our metrics, and we are currently vaccinating in phase 2 for the COVID-19 vaccine. We are specifically focusing really at this time on older adults, and then also are working from a directive from the governor to get schools and school staff, so school staff vaccinated as well. As we kind of move through the phases, you can look at our website to see kind of where we're at and who we're currently vaccinating in phase 2. For our metrics, we are sitting at about 4.6% positive right now. So that means we've got about 4.6% of the tests that are done are showing up positive, and that is stable for what it's been for the past couple of weeks. We do update these metrics weekly at the website provided, and if you do have any questions about kind of what's going on in the metrics, we do report them by test day, and so numbers can change from report to report. Most changes will occur in the most recent 2 weeks. And for deaths, we do report those based on the dates the patient died. So deaths may change further back than what you might see if you look at the numbers on the dashboard.
There's a question.
So there's a question, what is the recommendation for testing on people who have previously turned positive and are now fully recovered? So the recommendation is not to test them using PCR for 90 days. Because a PCR test can pick up kind of a lingering, we call them like lingering positives, that's not an official term, but it is sensitive enough that it will pick up potentially viral particles for about 90 days, even if they are recovered and no longer in isolation. If somebody is within that 90 days and does develop symptoms that are consistent with COVID, has been released from isolation, develops those symptoms, the recommendation is going to be having them do an antigen test. So the rapid test is going to be the recommendation for that, because if that comes up positive, it's more likely to be that they actually are positive, not kind of that lingering from their previous infection. And so that's the document that we have that has the guidance for the quarantine after vaccination also includes the recommendations for testing after somebody was previously positive. So we'll make sure you get that as well. And now I'm going to turn it over to Annette for her updates on visitation.
Okay, thank you very much, and thank you for being here. Next slide, please. Okay, so KDADS has instructed that adult care homes and nursing facilities use the 2-week county positivity rate that is published by KDHE. So this is the site to get that. So when you're looking at activity related to visitation testing, you're to use the KDHE established positivity rate. It also advises that adult care homes continue to use that positivity rate when making facility reopening and visitation plans. So that is, as you have seen in this presentation so far, the Sedgwick County positivity rate reflects differently than the one established at KDHE because it does lag behind, but that is the one you're required to use. Next slide. So KDADS has issued visitation guidance for all long-term care settings. They apply for, of course, all nursing facilities, assisted living, board care homes, homes plus, and residential healthcare facilities. The types of visitations during low, medium, and high positivity rates are for the indoor during low and medium positivity rates, according to the facility's environment and the residents' needs. Compassionate care outdoor and window is available during any phase. Okay, and there's a link for additional information. Okay, so for the visitation guidance established for long-term care settings, if it is under greater than 5%, it's green. Visitation should occur according to the core principles of the COVID-19 infection prevention and facility policies beyond compassion care visits. Medium is in the 5 to 10%. So again, visitation should occur according to the core principles of COVID-19 infection prevention and facility policies, and that is beyond the compassionate care. And if it's high, visitation should, and that's where we had been previously, it was above 10%, visitation can only occur for compassionate care situation. So we are now at the medium. We're still at a little above 5% according to KDHE. That does allow facilities to provide for indoor visitation and not just the compassionate care or outdoor visitation. So again, based on what's happening in your facility, if there's any current outbreaks or any positive cases, then that does affect that definitely. And you go back to the higher scrutiny level. But if it's at that 5% and under 10%, then visitation should be allowed based on your individual situation. And there's another link there for KDHE and Kansas information. So healthcare facilities, of course, should always review CMS and the KDADS guidance for visitation. CMS provides the guidance for nursing facilities, and that was issued on September 17th, 2020. There's a couple of different links for there. For all other facilities that are not licensed as nursing facilities and receiving Medicare and Medicaid reimbursement, then KDADS did put out visitation guidance for all other facilities. That was in October of 2020, and there is the link for that. It pretty much mirrors what CMS has for nursing facilities with a little bit more detail for those adult care homes. Next. There is also KDADS did put out this brochure, about new nursing facility visitation guidance. And this really is something that's very helpful for family members and the residents to help them know about visitation and what can be, what they should expect there. So they know kind of some of those criteria and those constraints around the visitation. There still needs to be following those guidance for masking and social distancing. And so those protections are still in place. The facility would need to have a visitation plan and share that with family members and can establish how often the visits can occur, how many visitors, how many visits a week, those kind of things, and how a person would schedule that. So this is a really important document to share and to help you. Each facility should have a visitation plan in place and be able to be sharing that with family and residents alike. And here's a couple of links. There's a link there also for more information on that and for this document. Okay, so the KDADS Nursing Facility Visitation Guidance, certainly, and you can see this in the KDADS document, that it really is a very person-centered approach. So that visitation is tailored for each individual and again, adheres to the core principles of the COVID-19 infection prevention. During a higher phases that did allow for the outdoor window, because that does pose for a lower risk of transmission due to increased space and airflow. But again, because we're below 10% in Sedgwick County, that indoor visitation is allowed and is encouraged because of the importance of that for both the individuals residing in the facilities and the family members and just for the overall well-being of the individuals. Okay, next. Again, during times when it's above 10%, it does allow for outdoor and compassionate care. And still need to screen all visitors during visits for symptoms of COVID-19. Must ensure that visitors and residents wear a cloth face covering, face mask during the duration of that visit, that they ensure practice social distancing. However, that can be modified in compassionate care visits based, again, on that very person-centered approach and those needs. So this just kind of goes back for the indoor compassionate care visits and when those are allowed, and that those are allowed during any phase. And that really, again, very person-centered. And some of the types, but not limited to, would when the resident's in hospice care, resident's illness or disease is worsening or life-threatening, the individual is exhibiting significant decline physically or mentally, withdrawing, no longer eating, showing signs of depression, cognitive issues that hadn't been seen before due to the isolation. So these are just a few of the things for compassionate care visits, but this is not an extensive list. Okay, next. So it's just, again, back when when the positivity rate on the KDHE website exceeds 10%, no indoor visitations are allowed except for the compassionate care per CMS and KDADS guidelines. And it's important to consider and look at that regarding the new cases in a facility, that there must have been no new nursing home onset COVID-19 cases in the nursing home for 28 days. And again, if there is an outbreak or a COVID case, then that would revert back to a higher level of restriction. Okay. It's also important when you have the visitors that they are reporting back to the facility if they have subsequent illness within 7 days of the visit. That should be reported to the nursing facility or adult care home and the Sedgwick County Health Department. Okay, I see that there is a question here. Does indoor visitation have to be in a specific spot in the nursing home, or can it be in the resident room? It can be in the resident room. That is allowable. Facilities can also designate a certain space. Oftentimes the residence room might be a better fit and better for the individual, but that is up to the facility to determine that. Okay.
There's that question for them.
Okay. The current CDC Visitation Guidelines applies to all long-term care facilities. Visitations may continue in consultant with local health as per current CDC guidance, and that was kind of reflected in that previous question earlier on, that certain types of decisions are left up to the local level, the health department. And the guidance does apply even if all staff and residents in a facility are fully vaccinated, as vaccines are not 100% effective. So again, that speaks to why you need to continue to make sure that masks, face coverings are worn, and that social distancing is in place. Okay. And I think, Kaylee, do you do this section?
Yep, I can do that. So these are just some general resources that are available. They'll be available when you get the slide deck after the presentation. So we've got information from CMS, the Department of Health and Human Services, and the CDC's MMWR updates. So there's different things from COVID-19, flu funding, the information about vaccinations, links to both KDHE, emergency management, aging, our health department website. So there's a lot of great resources out here that you can check out. You can also access any past webinars that you're interested in reaching as the website provided as well. And if you have any questions or comments, then you can reach out to Susan, and her contact information is provided as well. And so that is everything we have to present today. So we'll move into questions, and just a reminder, our next webinar is March 26th from 2 to 3 p.m.
There's that one question.
Yeah. So we've gotten one, so feel free if you want to put them in the chat, or you can unmute. We did receive a question. We have residents that are here for rehab between vaccination doses. Will Sedgwick County Health Department ever provide home vaccinations? I can't speak to that for certain at this time. We are doing a lot of planning in various aspects, looking at the best way to serve our residents. So I can make sure that I'm sure it's already been considered. I can make sure it's on their radar. But at this time, we're not doing that at this time, and I'm not sure if or when we will start doing that in the future. Do we have any other questions? I am not seeing any in the chat.
How about herd immunity?
Herd immunity? So
Yes.
we, herd immunity really depends on what, it's very specific to the virus. The last research I've looked into, and it does change as information changes, was looking at around 60 to 70-ish% would need to be vaccinated for us to achieve that. I would have to, again, double check to make sure we're still at that. But we just, at this time, it's really kind of limited by vaccination supply. As we get more vaccines, we're doing our best to get vaccinations out as quickly as possible, as are some of our other partners as well, and kind of everyone across the state. And so it's going to take some time to reach that point, just based on the nature of kind of the situation we're in. But right, like I said, last estimates I had looked at, and that was about a month ago, was looking at around probably closer to 70% vaccinated before we achieve herd immunity. And that can always change again as potentially new variants come out or new vaccines come out. There's always kind of ever changing with COVID.
Are there any further questions or comments from any of the audience today? Well, if anyone has anything to follow up with, you can feel free to email me at my email address on the previous slide. Anyone needing any assistance in between our webinar sessions, please also feel free to contact me, and we will get a response for you. And we have several items that we'll with from our session today. The slides will be reviewed for final, once that is completed, we'll post those on our archive page. The link is provided in this PowerPoint. And you will also receive an email with the actual PDF of the slides and, of course, the link to the archive site for long-term care facilities. So we appreciate everybody taking time to join with us today. And again, we apologize for our late start with our technical matters in the beginning. We appreciate you as partners with us. And again, anybody having any further questions, follow up with me by email. And thank you very much. And at this time, we'll just sign off unless anybody, speakers or anyone has any comments. There being none, I guess we'll just let everybody go back to your day. Thank you very much, and have a wonderful day, and thank you. Bye-bye.